You sometimes may see shingles referred to as herpes zoster or sometimes varicella zoster. And I've never suffered from it myself, thankfully, but people that I've talked to, my mother's one of those, has suffered from it. It's extremely painful. It's like a burning sensation where you've got the nerve cells that are inflamed, I guess. There is a vaccine now that they're encouraging anyone over the age of 60 to get vaccinated for shingles. Basically, to prevent the virus from remanifesting itself. Kind of like a booster shot, if you will. We also have a vaccine for chickenpox, developed in 1995.
So I've seen that vaccine on the chickenpox that
Say that again?
the amount of people getting chickenpox has gone down. I know I'm talking with my daughter's doctor. He was saying they were seeing less amount of cases these days.
I would hope so. I would hope so. Now I don't know if I don't know how many people are actually getting chickenpox vaccines. I don't know if it's part of the general regimen for children. I know my daughter was never vaccinated for chickenpox because it wasn't available. At least it wasn't mentioned to us through her doctors at the time. So I'm not sure what the regimen is now, if they're giving it to children early in life or when they're doing it, or if parents have to ask for it. You know, it might be one of those things where you actually have to ask your doctor for it.
Well, I know the doctor was recommending, please do this if you think about it.
Yeah.
Well, I've had it before, I know what it feels like, so yeah, why not? So I know we've been asked by our doctor to think about that, we've done it.
And that's great, because if you get vaccinated for chickenpox, you never have to worry about getting shingles.
Exactly.
Yeah. What's that? No. Maybe they are. I don't think so. I don't know. I don't know about that. That's a good question. Are shingles contagious? Someone should Google that.
Actually, they are, because I had a patient who had shingles and we had to isolate him.
Okay, great. And it makes sense that they would be, because if you think about the infection, okay, so we're talking about a virus that's infected nerve cells. How's it going to spread to other people if you're old and dying? Okay, if you're old and dying, the only way it's going to do that is if it remanifests itself as shingles, and then hopefully it can be transmitted to other people. And that's not uncommon. That's why we see a lot of disease in older people that would have been latent in someone that's young and healthy. If you think about a microbe that's living in a cell, like HIV or chickenpox or herpes, all of these that are living inside cells, if their vehicle is dying, they're going to die with their vehicle unless they can transmit themselves. And so we see, as you get older, your immune system depressed, that gives these microbes that are living latently in your cells a chance to manifest themselves and be spread to new bodies. Real quick, two more that I want to talk about here. Measles. So this is caused by the rubeola virus. Now, because of immunization, we've seen a significant decline in the disease. We have an attenuated vaccine for it. If you do come down with measles, it's not uncommon to get secondary infections. And about 5% of the cases become pneumonia or turn into pneumonia. Again, because of the depressed immune system. The virus has an envelope that allows it to attach and fuse with the cells. And so this allows for the infection to take place. We acquire it through the respiratory route. So you have to inhale it, and it spreads by way of the lymphoid tissues. Our vaccination regiment has dropped the cases of measles from 400,000 a year down to about 100 a year. Well, up until a few years ago, in the Midwest, we saw an increase in measles, another breakout due to lower vaccination rates. So we get this ebb and flow, where when we have breakouts, people rush to get vaccinated, and when there's no breakouts, they stop getting vaccinated. And so you get this sinusoidal wave that develops. The other one I'll mention here is German measles. This is caused by rubella. It's generally mild. You have a faint rash. Again, enters through the respiratory system. Multiplies in your nasopharynx area. Can make its way into the bloodstream. And again, we have a attenuated vaccine for German measles. Both of these vaccines are given in I don't want to say sequence, but in pairs, I guess. I don't know what the word, I'm missing a word here. But you'll get the first shot usually around 12 months old, and then you'll get the second one somewhere around 4 to 6 years old. Warts, papillomavirus. So you get this from playing with frogs, and sometimes they urinate on your hands, and then you'll get warts. No, it's not. So that's what my mom used to tell me. And as a child, I had warts all over my hand. I used to have to go and, they'd freeze them off, and then I'd burn them off, and it was terrible. Not uncommon to get warts in weird places too, because of the way that they're spread. You have to have direct contact with the microbe, and it has to come into contact someplace where the skin has been broken. And we see a lot of times that wrestlers will come down with warts in weird places like the knees and elbows and stuff like that because of the mats that they're wrestling on. Those get contaminated with the papillomavirus, and then they get introduced into the cuts and things. The papillomavirus is the same virus, and I'm not saying the one that causes warts is the same one, but the papillomavirus is the same one that causes cervical cancer. There's some 80 different strains of the papillomavirus, the human papillomavirus. And we have a vaccine that treats, I think, for 4 of them now. Okay? The ones that are most prevalent in the cervical cancer cases. They're recommending children, girls, ages, I think it's starting at 8 or 9, to get vaccinated. And it used to say up until age 26, but I think they're even allowing for vaccination beyond that. But the reason they wanted girls, 9 to 26 to be vaccinated, and after 26 you're on your own, is because they figure by the time you're 26 you've been exposed. If you haven't been vaccinated by that time, you've probably been exposed already. Through sexual intercourse, through the use of tampons, some other means you've been exposed to HPV. And check this out, now they want boys to get vaccinated as well. So they're encouraging boys from the ages of 12, I think, to also get vaccinated for HPV. All right, I'm done tonight. We've got 2 more lectures. That's all, just 2 more.